Okay, let's move on to question 3 then. This was about how trust can get the best out of their nurse leaders, particularly their chief nurse director of nursing. And you also had a question about how can a bad nursing culture be turned around. Who is answering this?
Thank you. Hilary Chapman, Sheffield, hopefully again representing the views of the table. We had a wide-ranging discussion, and I think we answered the questions in the end, but we didn't do them in the order they were put down. We started by saying that it should be a fundamental requirement that hospitals have a methodology of knowing how many nurses they need to care for patients safely, what impact that input is having in terms of outcomes, and that they're measured regularly. But the value of the chief nurse on the board is then about, and then what? Because if you have a well-staffed ward and poor outcomes, or vice versa, you then need to have the expertise to say, why is this ward well-staffed but the outcomes are poor, or vice versa, and look at the other reasons that might be causing that ward to, in inverted commas, fail. So that was our first bit of discussion. We then went on to talk extensively about new chief nurses. I think many of us around the table have had the privilege of growing up in a system where we've had a very strong leadership culture in nursing. We've had a chief nursing officer, regional officers, SHAs, whatever form they've taken. And we feared for new chief nurses coming into the system in terms of what support they would get, how they would network, what leadership development they would have, and really how we maintain quality and safety in the emerging architecture. And that's the challenge we have to take on. About how chief nurses, new chief nurses, actually manage to balance that judicious mix of knowing exactly what's happening in your organisation, but also being outward looking as well, so being able to scan the horizon, and having the bravery to challenge as a new chief nurse as well. We talked about growing good nurse leaders throughout the organisation in terms of leadership training, mentorship, and we talked quite a lot about role modelling and the value of a very positive and powerful role model, and how you get exposure to things. A number of us around the table said that the first board meeting we attended was our first board meeting as a chief nurse. And maybe as a chief nurse, you should actually have exposure to that before. I was fortunate enough to have that. As a chief nurse, the importance of being part of a team with your executive colleagues, and absolutely no room for complacency or arrogance. If you think you've cracked it, you probably haven't. That chief nursing roles are very lonely, and to never stop asking the question, which I think Catherine asked in her presentation earlier, is this good enough for my family? And if it's not, then it's not good enough. We did finish by answering the question about can you break, I think, the bad nursing culture, can it be turned around? We concluded that yes, you could, but it makes you unpopular. But it makes you unpopular for the right reasons. I think you have to have experience to do that. I think you have to be very brave. But we also talked about the importance of patients being able to identify who's on the ward and identity of the nursing roles. But also we talked then about continuity of care, and we did have a little diversion into discussion around 12-hour shifts.
Just tell us what, that's a good idea, is that where you're coming from?
Well, I'm not saying they're not a good idea. I think that 12-hour shifts possibly don't provide as much continuity as a traditional shift pattern, and there is some very good evidence around that. Sadly, it's very good evidence, but it's not, it's equivocal. And I think it's something we need to look at on an individual ward basis. I don't think it's a blanket thing that you can just withdraw 12-hour shifts. You've got to look at other indicators.
We have a lot of chief nurses from different types of trusts in the room. What are your comments on what you've heard? Do you fear for your colleagues in the future? About new chief nurses coming in when they haven't got SHAs, for example, will they be able to get the support and development they need?
Hi, I'm Nancy. I'm from Whipps Cross, and I'm in an acting director of nursing, and I've been in post for a month. So maybe I should be able to speak about this. I think as a deputy director of nursing or assistant director of nursing, and here we are, we have very poor nomenclature in nursing because we're all called different things, even at the highest level. I think that we do need to develop them much earlier. I think that although we have aspiring nurse directors courses, I think it goes much earlier than that, because nurses and governance together are the sentinels of safety. And we need to be able to vocalise and challenge in a very proactive and positive way about how we can turn around the situation. And I want to link that same argument with about the nursing culture, because it isn't about nursing culture, it's about organisational culture. And I can speak very clearly. Whipps Cross was at the bottom of patient experience in 2008, and many of you have heard me speak nationally about what it was like to be in that situation. And we launched the patient experience revolution around behavioural standards. And speaking to Liz on our table, it's very difficult for the public to appreciate that professionals, clinicians need to be taught how to speak to patients, how to meet their expectations, and how we can actually deliver. And every one of us in the room has a responsibility to admit that none of us can stand up and say this doesn't happen in our organisation, and what are we going to do about it? And actually it isn't just about being the nurse director on the board, it's about linking with your medical director and your clinical directors. And actually, I suppose it is call to arms, because we insist that every single member of staff at Whipps Cross goes on service standards training, and it's about the art of being, how to bring those together, how to deliver the service standards. And we still don't get it right, because it's a very long journey, but we have to do it now. So as a new nurse director who is looking out to improving standards, I would say that the support I need comes from the board and all of my I suppose the chief nurses around me, but also the team around me, because this is about working with the sisters and charge nurses and the senior nurses, but also governance together. So I don't feel alone at all.